If you're watching this, you're here because you or someone you know and love just broke or chipped a tooth. Not to worry, I will help you navigate the next steps. Hi, I'm Gina. I'm a registered dental hygienist and a Burst ambassador, and you're watching Burst TV. I did ask a few of you what would be the craziest ways to break a tooth. You told grandma the dressing was dry. Guess what? She throws a fork at you. You went into a turkey coma and fell flat. You got into a fight over the last turkey leg. It goes flying in the air, catching Uncle Jim right in the mouth. Picture this. Turkey dinner's over, dance party ensues, and all of a sudden, you're doing the worm, and family dog Murphy tackles you, and you know where this is going. First of all, if you chipped your tooth during the holidays, I am so sorry. Let's stay calm, take a deep breath, and let's go through a couple scenarios and options for what to do. This is especially important if you cannot immediately see your dentist. If you chipped your tooth, first, let's assess the situation. Get a friend or maybe a couple friends to help you. Pull your cheek back out just like this and see if you can get some good lighting on the tooth. If you need to get a flashlight to see what's going on, that's totally fine. Oftentimes your phone flashlight can do a pretty good job with this. It is helpful if you can take a picture of what you see. You can either use a flashlight or use your phone for a flashlight and then another phone for the camera. If you need to send a picture to your dentist, then you'll have it right there. And once you get a good view, compare the tooth that chipped or broke to the teeth right next to it. Does it look like a big or a small piece came off? Does it hurt? Is there bleeding in the area? Did a crown or filling pop out of the tooth? If you are in severe pain, if the whole tooth is knocked out, if there is bleeding, immediately put the tooth in milk, not water, but milk, and get to an emergency dental clinic as soon as you can. Apply some pressure and an ice pack to the area and take an over-the-counter pain medication if needed in the meantime. But if your problem is not as severe and you see just a small piece of tooth or filling material, you actually don't need to keep it. Once a piece of tooth is broken, or even if a filling came out, it cannot actually get reattached or bonded back to the tooth. If you compare the chip on the tooth that chipped to the teeth next to that tooth, you can actually get a better idea of the extent of the damage. If your chipped tooth looks very similar to the teeth next to it, there's no pain, then don't panic. As soon as possible, see your dentist. They can take a look visually or take an x-ray if needed and let you know what the next steps are. Even if the chip looks really small, you should still see your dentist, especially if it goes in between the teeth, because what can happen is food, bacteria can get stuck in there. That over time causes gum inflammation, it can cause pain, it can even cause tooth decay over time. Maybe you bit into a turkey leg and a porcelain crown or a veneer came off. In this case, take a close look at it. Again, make sure you have good lighting for this. Does it look intact? Does it have smooth edges? Does it look chipped or like a piece is broken off? Maybe it's broken in half. If a big piece of the crown is missing or if it came out in two pieces, unfortunately, you won't be able to put it back on the tooth. But if you do see a fully intact crown, then make sure you keep it because your dentist may be able to put it back on with cement once you can get to the office. In most cases, the crown can be re-cemented or replaced if needed, but sometimes more extensive treatment is necessary. If you can't get to the dentist within the next few days, it's important to temporarily put the crown back on, not only to protect the tooth, but also because if the crown stays off for too long, you may start getting pain in the area, your bite can shift, and your old crown may not fit back on the tooth, in which case you would need a new crown. So to avoid that, I'm going to go ahead and show you how to put your crown back on temporarily. Temporary, before you can actually see your dentist. So you're going to have three options for the glue that holds your crown back on your tooth until you can go in. The first one is going to be temporary cement. You can buy this for a few bucks at any grocery store or pharmacy, but time is of the essence because you want to get your crown back on as soon as you can. I don't recommend buying it online, waiting for a few days to get temporary cement. If you can't get to a store, you have two more good options to put your crown back on. The best option after temporary cement is going to be Vaseline. After you've cleaned the inside of the crown, put a small little dollop of Vaseline inside, just enough for it to go right in the middle of the crown, of the inside of the crown. And if you don't have any Vaseline, the third option would be to use simply toothpaste. So option 1, Vaseline. This is a tiny little container, but any kind of Vaseline works, or toothpaste. Number 1 thing you're gonna do, first wash your hands. Then you're gonna get a little small bowl, put the crown with some water in there. You don't wanna lose your crown down the drain. Take a toothbrush and just gently clean the inside portion of it. After your crown or veneer is clean, practice putting it back on the tooth and see if it fits back on there. Notice that there is a front and back side of the crown. So if it doesn't fit one way, then turn it 180 degrees and see if it fits. If it looks like it fits back on the tooth, we are in business for a temporary solution, okay? Once you have your crown ready, make sure the area in your mouth is clean. You can rinse with a little bit of water, get a quick visual again, either with a flashlight or just in a well-lit bathroom. And right before you put the crown back on, go ahead and close your teeth together and breathe in like this. That way you can get the area just a little bit dry without too much saliva in there. Now you're finally ready to place the crown back on. And once you've done this, you'll be okay for even a week or two if you are able to get your hands on temporary cement. If you only have toothpaste or Vaseline, I actually don't recommend waiting longer than a few days to get your crown assessed by a dentist. Even if it looks and feels okay, you just never know if there's decay or a crack in the crown that needs to be addressed. In the meantime, please be extremely careful with that tooth. If you're able to, try to avoid chewing on that side, but do make sure that you're still brushing in the area. For cleaning in between the teeth, I recommend using a little proxy brush, just like this one. This just goes right in between like this. Let me show you. Super easy to use. And if you do want to use string floss, pull it through and not back up when you're done. If the tooth is very sensitive, just make sure you avoid very hot or very cold foods and drinks on that side of your mouth. So if you have any more questions about a chipped or broken tooth, you know we are here for you in the comments. If you enjoyed this video, hit like, subscribe, so you can be notified when a new one comes out. Thank you so much for watching Burst TV, and I'll see you next time.